Hello, my name is Hansol Park, doctor of Mokhuri Korean Medical Hospital. Many patients exercise a lot to overcome spinal stenosis. Today, I would like to tell you about 4 exercises that stenosis patients should never do. Please watch this video to the end and try to avoid these 4 exercises in the future. The first exercise that patients with spinal stenosis should never do is mountain hiking. The reason is because it puts too much strain on patients' backs. As was explained in our previous video, 10 lifestyle rules that patients with spinal stenosis need to know. It is forbidden for patients with stenosis to engage in excessive activities. In this video, I forbade you from engaging in any kinds of exercises or activities that exceed 30% of the normal activity or intensity. And in the case of mountain hiking, will worsen your spinal stenosis symptoms. Therefore, instead of mountain hiking, it is highly recommended to walk on flat surface. As a reference, I recommend you to watch another video called Exercise for Spinal Stenosis, How to Do Walking Exercise. Among the patients with spinal stenosis, there are those who say that back and legs do not hurt and it feels more comfortable when hiking rather than walking on a flat surface. What is the reason? Well, in general, when hiking a mountain, you do it with your back bent, right? When you bend your back, space in the narrowed spinal canal is secured and the nerve pressure is relieved to some extent, allowing you to feel temporary comfort. Moreover, when we do strong exercises such as mountain hiking, our body starts to react by sweating and increasing body temperature. And eventually, hormones called endorphins are released. In fact, endorphins are well known as an effective hormones for pain reduction. That is why you do not feel that much pain when you going up to the mountain. However, descending the mountain is a bigger problem. Descending from a mountain can put a severe impact on your lower back, which can make your symptoms worse later on. If your back feels stiff on the day or after a day after hiking, it's best not to do it because it's a sign that it is straining your back. The second exercise that patients with spinal stenosis should not do is the McKinsey exercise. The McKinsey exercise is a well-known method for the lower back, but you should never do it if you have spinal stenosis. Stenosis is a degenerative disease that causes the ligaments in the spinal canal to thicken and compress the nerves. So if you lean back, the spinal canal becomes narrower, putting more pressure on the nerves and making the pain worse. But some patients still keep doing these exercises during the pain. I repeat, exercising with pain can make your symptoms worse, so please do not do this. The third forbidden exercise for patients with spinal stenosis is to raise both legs while lying down. In our last video, we told you about knee exercises and hip joint exercises, which are good ones for spinal stenosis. These 2 exercises requires you to do one leg at a time. However, there are patients who start to increase the intensity by lifting both legs because the exercise seems too easy. Lifting both legs at the same time in that way puts a lot of strain on the lower back, which can aggravate stenosis, which can make stenosis condition worse. Therefore, it is recommended to do it with one leg. The fourth and final forbidden exercise is to walk with pain. There is a different method of walking for patients with spinal stenosis. You can check this method in the last video, Exercise Good for Spinal Stenosis, How to Do Walking Exercise. However, in general, patients with spinal stenosis feels pain when walking. But they say that sometimes when you keep walking, the pain goes away. In the case of stenosis in the early or middle stages, some people may feel that it gets better right away if you endure the pain and walk. But it is very bad in the long run. In other words, the distance you can walk without pain becomes shorter and shorter. Therefore, if you feel pain while walking, you should rest immediately and only walk as long as it does not hurt. The reason patients with spinal stenosis do exercise is to improve their symptoms. However, there are many cases where the symptoms worsen rapidly due to excessive exercise. Also, if you do any exercise that is floating around on the internet, it is not a good decision. Your symptoms can get even worse. If you feel pain after exercise, take a few days off and take a break. If you still feel the pain even after adequate rest, the treatment is required. Regardless of the early, middle, or last stage, spinal stenosis can be treated non-surgically with the Oriental medicine. So don't worry too much and take action before it gets worse. Thank you.